Is VenaSeal enough? When we talk about doing a vein procedure, when my patients ask, you're going to treat this by VenaSeal, and they have these big bunches of veins, is VenaSeal the only thing that we are going to do? If not, do we need to do something else along with it? VenaSeal is like the main course in a meal. Just VenaSeal is just closing the straight vein. We need to do something for the other branches as well. Hi, I'm Dr. Saurabh Joshi here. Is VenaSeal enough? When we talk about doing a vein procedure, when my patients ask, you're going to treat this by VenaSeal, and they have these big bunches of veins, is VenaSeal the only thing that we are going to do? If not, do we need to do something else along with it? So typically when I advise a procedure, when we are talking about doing a procedure of VenaSeal for any patient who has moderately advanced varicose veins, this is the C4, C5, C6 category of the CAP classification. If you have big bunches of veins, swelling, skin darkening, or wounds on the legs, then typically just a truncal vein closure or either a VenaSeal, laser, radiofrequency ablation may not be enough. Typically, these patients have some bunches of veins, some perforators, some under ulcer varicosities, ulcer under ulcer bed venous system which is enlarged and refluxing. These patients need secondary procedures as well. Now typically how do we do that? So VenaSeal is like the main course in a meal. If you come to my house for lunch, would I just give you vegetables and the rice and roti? No, you would still have a salad, would still have a juice, you would still have a dessert, right? To complete the meal we need to do multiple things together. Same way, just VenaSeal is just closing the straight vein. We need to do something for the other branches as well, because these bunches of veins don't allow a straight device to go through. That device may be a VenaSeal device, that may be a laser device, that may be a radiofrequency ablation device. For these bunches of veins, we typically do concurrent sclerotherapy. Sclerotherapy is also a way of closing veins, but this is meant for short distance veins and bunches of veins where devices can't go. If these veins are very large, and there is a way to direct inject glue inside these bunches of veins as well. Typically, we need to close veins which are under the ulcer. Now, to treat under the ulcer, and if these are bunches of veins, the VenaSeal device would not enter there. So we have to do a direct injection sclerotherapy into these bunches of veins for a completion. Although sclerotherapy per se by itself is not the whole procedure, it goes along with VenaSeal. If a patient has had some kind of a main or primary procedure like VenaSeal or RFA or laser, and then they have smaller veins, and then yes, sclerotherapy can be done separately. But typically when we say VenaSeal, we mean VenaSeal plus some secondary procedure, either direct glue injection in the perforators or sclerotherapy in the bunches of veins. That's why typically in a scenario where patient has moderate to severe varicose veins or venous ulcers, just VenaSeal is usually not enough. You need to do something more. Thank you.